All right, so bones of the skull. The skull is kind of interesting in the fact that it actually has quite a few bones just within itself. As well, those bones have specific parts and pieces to them. So I don't want you to panic when you see how many things you're going to have to know in the skull, because a lot of them are repeated. For example, this is the frontal bone. This is the frontal bone. This is the frontal bone. If you're looking at it from this direction, you can kind of see this is the frontal bone. So a lot of the terms that you're going to have to know are literally the same thing. It's just shown from a different angle. So don't panic, okay? Everybody always panics when they see the figures with everything highlighted. What they don't realize is a lot of what I'm showing you is the same thing. It's just repeated from this angle, from this angle, from this angle, from this angle. It's the same thing though. It hasn't really changed. So, or not. Okay. Sure. So this is the frontal view of the skull. Basically, it's the anterior view. You're looking at it this way, directly head on. The parts that hold your bones together in your skull are called sutures, and they're what we call interdigitated. So they look like this, where they are basically held together very, very well. And if you look at the skull here, well, I'll just do that. You can see that they are interdigitated. Now, technically, these are considered joints because they are holding two bones together. It's where two bones articulate or meet. You got to remember that if you have two bones like this and you shift, there's a real good chance that they'll slip and slide on each other, especially if they're flat surfaces. If you have them like this, where they're actually interdigitated, they can't slip and slide because they're literally locked in to each other this way. Okay, so, sorry. Dun, dun, dun. All right, so looking at the skull, we've got the frontal bone. That's kind of your forehead, okay? Right here, you can actually feel this if you feel right here at the top of your nose. These are the nasal bones. Yes, I know, they're the nasal bones. You've got the temporal bone in yellow, and between the orange and the pink here, the orange is the parietal bone, by the way, you've got the coronal suture. Now remember, the coronal plane was the one that cut you into front and back halves, right? So the coronal suture, where are we? Base, is the one that basically does the same thing, front and back halves, okay? So we've got the coronal suture. This kind of predominant little fold right here that you have right between your eyes at the top is called the glabella. And I'm sure you know that this is your eye socket, right? So here's the supraorbital margin. Orbital meaning the hole or where your eye is. Let's see. Here's the infraorbital margin, infra below. This is the zygomatic bone. Now, the zygomatic bone is what everybody wants from Angelina Jolie because everybody, oh, she has such good cheekbones. So that's what that is. Okay, so that's the zygomatic bone. Here, in this kind of lighter orange, this is actually the maxilla. Okay? The maxilla makes up the upper part of your jaw as well as the lower part of your eye sockets. Internally here in the nasal cavity, you've got this inferior nasal concha. These kind of make these C shapes so that when you breathe in air, it causes the air to rotate so that you actually are filtering air better when you're breathing. Down here, you have the inferior nasal concha. And then down right here, down the center, you've got the nasal septum. Now, the nasal septum is actually made up of two parts. The perpendicular plate of the ethmoid bone, and then at the bottom in blue, you've got the vomer. Okay, the vomer is kind of this long strip of bone. Down here, you've got the mandible. Okay, you've got the mandibular symphysis, which is basically where those two ends come together and meet. You've got the mental protuberance. That's this jutty part down here on your chin, okay? Now, why do they call it the mental protuberance? Have you ever seen the statue, The Thinking Man? He's kind of squatting a bit on a chair and he's like this or like this. He's called the thinking man, so mental. One of the other things that you have is a hole. Foramen means hole, or you can call it a foramen if you prefer. For me, personally, I think foramen because I think of how to spell it. I'm a terrible speller if you haven't figured that out yet. So, mental foramen. This is actually the hole where your nerves come up to your teeth and some arteries and veins also enter and exit through that hole. So, that's the mental foramen. Again, think of the thinking man. Okay. The body of the mandible is kind of this solid part here. I believe that's this little green piece right here. This is the lacrimal bone. So your lacrimal gland is your tear-producing gland, and you think of your tear duct being here. So that's the lacrimal bone. If you look at the skull, see that little rectangle right there? That's the lacrimal bone. It's about the size of your pinky finger. Let me make sure that I covered everything. The sphenoid. The sphenoid bone is this kind of lavender purple color, and it actually kind of sits right dead center in the middle of your skull. And almost every bone in your cranial cavity where your brain sits actually touches the sphenoid bone. You'll get a better look at it when we turn the skull. The supraorbital foramen. So again, foramen means hole. So again, this is an entrance and an exit point. Entrance for nerves, exit for nerves, entrance for arteries, exit for veins. So it's basically the way that we bypass the skull. Remember when I talked about the bone tissue, I said it's so hard you can't just burrow through it. That means that I've kind of got to have pathways already there for things to move in and out, including arteries, veins, and nerves. All right. I already went through parietal bone. Okay. So that's frontal view. Now keep in mind, in these figures, the colors are going to stay the same. So if the frontal bone in this figure is pink, all of the figures where you see the frontal bone are going to be pink. If the parietal bone is dark orange, all of the figures are going to have dark orange for that parietal bone. Now, will I give you figures that actually have colors like this? Probably not, because you're not going to have that in a regular practical in a regular semester. But if you know the locations of these things in the colored skull, you'll know it in a plain skull as well. So this is the lateral view. We went from this way to this way. Okay? Still the frontal bone. Still the zygomatic bone. Still the maxilla. Still the supraorbital margin. Still the supraorbital foramen. Still the nasal bone. Here is that lacrimal bone. Remember I said it's about the size of your pinky nail? Okay? There's a hole right here in the base called the nasolacrimal duct. You know that more commonly as the tear duct. This is where your tears drain when you are crying. It's also one of the reasons why when you're crying, your nose runs, because it actually goes down into your nose. So you got that nasolacrimal canal. Let's see, the maxilla, the mandible, again, hasn't changed, but, oh, and the mental foramen, again, hasn't changed. Here's the body of the mandible. The mandibular ramus is this flat portion here. The angle, see how it changes angles here? That's the angle of the mandible. Now, this actually goes up and forms a joint. Give me 1 second. So this actually fits into this space here. So these parts that we're about to go through are going to be these parts here, okay? So this part is called the mandibular condyle. This is what makes the majority of the joint for you to go, okay? This part, which is this flat part, as opposed to this part that makes that joint so that you can open and close your jaw, kind of looks a little bit pointier, okay? This is the coronoid process of the mandible, okay? Now, the zygomatic arch, wait a minute, zygomatic bone, zygomatic arch. This bone here is actually the temporal bone. Temporal bone is on the side of your skull. Let me try and put this back together real quick. So the zygomatic bone makes the cheekbone with this arch here, okay? And part of that arch is created by the zygomatic bone, but then the back part of this arch is created by the temporal bone. So that zygomatic arch, that whole thing, has two halves to it, depending on which bone it's coming from. So the zygomatic bone is going toward the temporal bone, right? So that's called the temporal process of the zygomatic bone, because it's the zygomatic bone making that process, going toward the temporal. This half of my temporal bone coming forward is going to be the zygomatic process of my temporal bone, because the temporal bone is what's making it, and it's going toward my zygomatic process. Now, in the temporal bone itself, we have several structures. There's a hole right here. This is the external acoustic meatus. This is your ear. You know that tube that goes into your ear right there? That actually is in your bone. You can see it right there, okay? So it's basically burrowed into the bone of your skull where you get into the internal ear. The tympanic part of that bone is here. This lump here is called the mastoid process. And this sticky outy part here that's kind of sharp looking, this is going to be the styloid process. So you've got the mastoid process here, the styloid process there. And you can see that styloid process, especially compared to this mastoid, is very, very pointy, okay? This is the Occipitomastoid Suture. And the reason that it's called that is because this blue bone back here is called the occipital bone, and this is the mastoid, so this is the junction between the two of them, okay? Parietal bone, you have two of them, one on this half and one on this half, which you can actually see real well right there. There's one parietal bone, there's the other. Okay, this right here is the squamous suture, and it's the suture between the temporal bone and the parietal bone. And then this right here is called the lambdoid suture. okay? So if you look at it from the back, do you see that shape, that kind of upside down Y? That upside down Y can be described as being a lambda in Greek lettering. So lambda kind of looks like that. So they call it the Lambdoid Suture because it looks like a lambda. Got that. All right. Now remember, we just talked about a lot of these. These are not all new words, okay? So don't panic. Remember, the frontal bone is always the frontal bone, no matter which direction you're looking at it. It would be like me saying, this is my forehead, and then doing this and saying, this is my forehead, and you panicking because you think it's a new part. It isn't. All right, so back of the skull. Parietal bones. Here's that lambdoid suture that I told you about. Temporal bone. What is that? The mandible, right? You've got the mastoid process. You've got the Occipitomastoid Suture. You've got the temporal bone, the zygomatic arch. None of this is new, but this is the sagittal suture. So remember our sagittal plane cut us into right and left halves? This one does the same thing. And if you look, here's the skull, right? Here's the front of the skull. Cuts it into right and left halves. That's why it's called the sagittal suture. And it's between the two parietal bones. Now the other bone part that is different or is new is this right here. This is called the occipital condyle. There are two tables in your book, and they tell you what all of these terms mean. For example, I said foramen means hole, right? Condyle means that it's kind of a protuberance that sticks out. So if you look down here, see this right here? Kind of sticks out a little. This is the occipital condyle, okay? So when you hear condyle, look for a sticky outy part. Now, this is the top of the skull. It's magnetized, so the magnets aren't holding very well. So here's the front, here's the top. This is what we're looking at. Again, nothing new. Frontal bone, parietal bone, occipital bone, coronal suture, sagittal suture, lambdoid suture. We've discussed this already. This isn't new information. It's just a new angle. Again, don't panic. Okay. Now, this is the inside of the skull. So here's the front. Here's the inside. That's what you're looking at. People have a tendency to get that and this mixed up. Okay, this is an inferior view. We're looking up from your chin, okay? This is a superior view internally. So that inferior view, so here's the skull, it's this, except they've taken the mandible off. So it's this. And you can always tell, always, because there are teeth in that inferior view. There are not teeth from this view, okay? So again, let's look and see what we got. Frontal bone, not surprising. Brain fart bone. Sorry, guys. Occipital bone, parietal bone. Notice the colors are the same. We've got the pink, we've got the orange, we've got the blue. Temporal bone, yellow. The zygomatic bone is out here in that green. This is that temporal bone of the zygomatic process, with the zygomatic process coming from the temporal bone that's making that Zygomatic Arch that we just talked about. This is the sphenoid bone. Remember I said it's kind of set in the middle and almost every bone touches it in your skull, almost every cranial bone touches it. This is it dead center. Now I'm going to go back real quick. One day I will learn that's not the computer I'm supposed to be touching. See the light purple? That's the sphenoid bone from the front, sphenoid bone from the side, sphenoid bone from the inside. Sphenoid bone, remember the bones that I showed you and I said these were the classifications, long bone, short bone, flat bone. Remember the irregular bone picture? That's that bone. That's the sphenoid bone. They actually used it on the cover of the movie Mothman Prophecies as if it was a moth. And I remember going to the theater and going, not a moth. Okay, so let's talk parts and pieces. Dead center here, you've got the ethmoid bone. And believe it or not, you can actually see the ethmoid bone through the eye socket as well. See that right there, that square right there? That's the ethmoid bone. It sits in the middle of the skull, okay? So looking at it here, you can see it right here, okay? And right dead center in the middle, you've got this thing that sticks up. I kind of call it a sail. And in here, see those little holes? That's actually where the neurons from your nose go up to your brain for interpretation. So you've got that sail in the middle right there called the cristagalli, and you've got this flat portion here that has these holes in it, okay? This is the cribriform plate, okay? Those holes are actually called the olfactory foramina because they're holes, but they're teeny tiny holes, they're just precious. Okay, so you've got that sphenoid bone. In the sphenoid bone, you have the lesser wing up here. The greater wing is down here. Okay, foramen, holes. Remember, bone has to have burrowed out regions for things to get in and out. So you've got the foramen rotundum. You've got the foramen ovale. I wonder why it's called that, because it's an oval. You've got the foramen spinosum. There's the internal acoustic meatus. Remember that hole from the outside? Look at this hole. This is a huge hole, right? This is called the Foramen Magnum because it is a big hole. Big and surprising hole. Yeah, okay. This little thing right here is called the Sella Turcica. So the Sella Turcica looks like a saddle, okay? It looks like you could put a little monito right there. This is actually where your pituitary sits in your brain, okay? It's a little house for that specifically. So that's internal structure. Now, internal. Underside. Let's talk underside real quick. Again, as far as the big bad bones, maxilla, zygomatic bone, sphenoid bone, temporal bone, occipital bone haven't changed. There's that vomer that we actually saw in the nasal cavity earlier. It's the underside. Here's my maxilla. This is the incisive foramen. Again, entrance and exit for nerves and blood vessels and stuff like that. But as you come back, you get to this pink bone here. This is the Palatine Bone, okay? So again, most people will say, oh, I burnt my palate. Well, that bone is way back here. The rest of this is actually the maxilla. So you've got the palatine process of the maxillary bone, the part that's actually in contact here with the palatine bone. The horizontal plate, because it's going across, the zygomatic bone, the vomer, like I said. Here's that styloid process, that sharp pointy end. See this right here? This is called the mandibular fossa. Fossa is a little indention, a smooth little indention. And with this particular model, it's kind of covered with cartilage, but it would be right there under that cartilage because this is where your jaw sits, okay? So the mandibular fossa is the little indention where the mandible fits. So you've got that. Here's the mastoid process. You already know what that is. The temporal bone, you already know what that is. The occipital bone, you know what that is. The foramen magnum. The foramen magnum is actually where your spinal cord gets to your brainstem, or vice versa. Your brainstem gets to your spinal cord. That connecting point goes through that foramen magnum, okay? Now, these occipital condyles, you saw those before from the back. Now we're just looking at it from the underside. This is really hard to do. So these are those occipital condyles. From the other angle, there's one, there's the other. Here are those styloid processes. Where's my other finger? There. There are those two styloid processes right there. There are the two mastoid processes right there. Okay. There's the external acoustic meatus. It's the same one as what you saw laterally. The foramen spinosum, right there. The foramen ovale. What's the shape? It's an oval. There's the sphenoid bone. Now, underneath, the sphenoid bone actually has two pieces. You can see them right here, okay? They're kind of coming out of the maxilla. So, you've got the medial pterygoid plate. Notice that starts with a P. The P is silent, kind of like saying pterodactyl. You don't say pterodactyl, you say pterodactyl, right? So this is the medial pterygoid plate. This is the lateral pterygoid plate. And then this is that greater wing that we described earlier, just seen from a different angle. So lateral and medial. Remember I told you guys that directional terms would come in really, really handy. This is one of the places where it's going to come in really handy. If you know medial means toward the middle and lateral means toward the shoulder, you're going to know which pterygoid plate is going where, because one's going to be toward the middle and the other's going to be going to the outside. So one's in the middle here, one's toward the outside here. Okay. Now the fontanelles. I'm going to still pause for just a second. All right. Baby skulls. Baby skulls have to fit through a very small hole. So, in addition to, they also have to grow fairly quickly. Think about a 2-year-old. 2-year-old's head looks really, really huge for their body. And it always looks like when they're walking, they're just going to go because their head is too big, right? Okay. Fontanelles are soft spots. That's what you hear them described as when people talk about, oh, be careful with their soft spot. But the reason that they're there, the purpose of them is so that the baby skull can compress. It can actually get squished when it's coming out of mom's vaginal canal or birth canal. As well as that, when the baby's head is growing so quickly, having solid bone would make it a lot harder for it to grow properly. So having soft spots means that you can kind of grow the head a bit faster. So the fontanelles are the soft spots, and you actually have, let's see, 1, 2, 3, 4, 5, 6. You have 6 of them. If you know directional terms, this is going to be really, really easy. If you want to learn the more complicated terms, I'm okay with that, but I think the directional terms make it a little bit easier. So, if you look, there's a place where the bones meet here, and then there's a place where the bones meet back here. This is the anterior lateral fontanelle. Anterior lateral fontanelle. anterolateral fontanelle. Anterior, front, lateral, side. If you want to call it the sphenoidal, I'm okay with that, but I think the directional terms just make sense, and then you don't have to memorize. Back here, you've got the mastoid fontanelle, or the posterolateral fontanelle, the back side fontanelle, okay? Then, looking at the top, you've got this fontanelle. Here's his face. And back here, you've got this fontanelle. So again, the back, back, okay? This is the frontal or anterior fontanelle. This is the occipital or posterior fontanelle. Now, remember I told you colors never change. The bones are the same. Remember the frontal bone was pink? Frontal bone is still pink. The parietal bones were orange. Parietal bone's still orange. The occipital bone was blue. Occipital bone is still blue. Zygomatic green. Sphenoid is purple or lavender. Temporal is yellow. The maxilla is still that orange color. Your nasal bones, your lacrimal bone, and your mandible. All the colors have stayed the same from the adult skull. So they're not changing that on you, and they're not making it confusing. For the baby skull, I want you to know the fontanelles, but also if you learn the bones from the adult skull, you should be able to learn the bones from the baby skull as well. All right, so that's the skull.